Oh, hi, everyone. I have a special guest with me today, and we are going to discuss home births. So, home births is something that I've always been curious about, a little bit scared of, but I know that it's something that a lot of women are choosing today, especially within the African American community. And so today I have Miss Cassandra Woods. She is a certified nurse midwife practicing here in the Baltimore area. And so I'm going to ask her lots of questions about a home birth and what it's like and all the things that I don't know so that we can just have a healthy discussion about, which patients are good candidates for home births and maybe those who should probably be seeing a doctor. But I wanted to start, Cassandra, just by asking you, so what does it take to become a certified nurse midwife?
Well, hi, and thank you so much for having me on today to talk about this. I think this is very important and will enlighten a lot of people. So, to become a certified nurse midwife, you have to become an RN first. And for the most part, it entails going to a 4-year college and getting a 4-year degree and getting a license as an RN and be in good standing. After you get your license as an RN, then you apply to a master's program to become to get a master's of science in nursing with a specialization in midwifery. So that's about another 3-year process. So about 7 years later, you sit and you take your boards and you can become a board certified nurse midwife. So um, that's about how long it takes. It's a pretty arduous process.
Okay. Well, that's good because that way, you have that experience, you have the educational background, and you are able to provide excellent care for patients. Um, and I wanted to also ask you, how long have you been doing home births now?
So I've been in private practice since September last year. Prior to that, I was at Special Beginnings in Arnold, Maryland, as one of the midwives on staff where we did births in the birth center and at Anne Arundel Medical Center. So the birth center is typical of a home birth environment. It's about the same. It's just that you in another house having a birth instead of being, having your birth at home. As a student midwife, I was with Birth Care in Alexandria, Virginia, and they have a birth center as well, and they do home births. So, learning as a student and moving into practice with the birth center kind of like gave me a well-rounded experience, and then you add in the hospital experience as well to practice and do what I do today.
Okay. So I guess there's not really a big difference between a home birth and birthing at a birth center.
There's not. So everything that we bring to the home for home birth is what you would find in a birth center, and it's pretty uneventful. A bed, a birth tub, and all the tools that you would need for birth, and for life-saving measures if necessary, to for life-saving measures for mom or baby.
Mhm.
So you can have it in the birth center, or you can have that at home with the home birth midwife.
Okay. So, and this is a little bit off, but why do you think some people choose to deliver at home versus at the birth center?
So at the birth center, you will birth and you stay at a minimum of 3 hours after the baby is born. And once the newborn exam is completed and your birth certificate paperwork and all is done, the family will go home. At home, when you birth at home, mom will have the baby and then get right back in her bed, so she doesn't have to get in the car and travel at all, and the team will come back to the house to visit with her on day 1 and day 2.
Mhm.
So it's it's almost like you never have to leave home. Everything happens right there, and you have a bit more control over who can be there. Some birth centers have rules on how many people can be present due to COVID, but for the most part, birthing at home will allow you to have family members present maybe not so many people in the room with you while you're birthing, but family members and all can be present and be there to support you. And yeah, and you never have to leave home.
Okay. Yeah, I was just thinking that it's just thinking about the birthing center and delivering in the hospital. So that's really different. You're saying that they only stay there for 3 hours after delivery and then go home. So in the
Yeah.
hospital, there's like a minimum of 24 hours after a vaginal delivery. So that's a big difference.
Yep. So about 3 hours after, as long as baby is doing well, mom is doing well, bleeding is like the bleeding that you would find on the heaviest day of a menstrual cycle, and pain wise, she's doing well and she is not symptomatic of blood loss or anything like that. Then we stay about 3 hours. We'll stay longer if necessary, but at a minimum 3 hours.
Okay. But and then I was noticing when you said for the home birth, you would see the patient again the day after delivery and 2 days after, just to make sure everything is going well.
Mm-hmm.
Yeah.
Yeah, so there's a day one visit and a day two visit. The birth team. So the birth team is the midwife and a birth assistant. And so on one day the midwife will come and one day the birth assistant will come. At the same time, the family knows they can always reach out to the midwife. There's a list of items or problems that, if identified, to call the midwife, and immediately we'll go back to the house.
Okay. Okay.
Yeah.
That's great. And I guess as far as the baby is concerned, do you look after the baby on those first 2 days as well?
Yes. So certified nurse midwives in the state of Maryland can take care of newborns for up to 28 days. I encourage my clients to have the baby see a pediatrician within 72 hours.
Okay.
So at that time, once the family has established care with the pediatrician will do all of the care for the newborn.
Mm-hmm.
Prior to that, if there's an issue with mom or baby, they'll be calling me.
Okay.
Yeah.
So that's definitely different than in the hospital, because we definitely know there's pediatricians on staff and they see the baby within 24 hours. And honestly, for me as an OBGYN physician, as soon as the baby is delivered,
Done.
I'm done with the baby. The pediatrician is there to help out. So yeah, that's different.
Yeah, so the midwives, we do newborn care. We do their head to toe exam. We administer erythromycin, eye ointment, vitamin K, and make sure that the baby's umbilical stump is healing well. Any problems with the baby, the family can reach back out to the midwife. And like I said, we take care of babies too. So, but not beyond 28 days. So if that's what the midwife decides to do, but in my contract with my clients, I'd like to end that care at 72 hours.
Okay. Yeah. So do you have any stories of a home birth that was really special or very memorable for any particular reason?
Sure. So as of this morning, I talked to the family that birthed with me with my first birth, the first birth of my way birth, which was Thanksgiving Day last year. And I just gave them a call this morning to see how they were doing, how baby is doing. This was baby number 5. And the family relocated here from Washington State. And they were here on base at Fort Meade, and they were looking for a midwife to have a baby at home. And everything went well. Mom called, and they were laboring, and okay, it's time. The team arrived, and she moved from hands to knees on the bed to the toilet, and in the dark in the bathroom, she birthed the baby on the edge of the toilet. And yes.
Okay.
It was really sweet. It was really sweet. And while she was birthing the baby, the other sibling sat on the couch quietly and waited for her. They were very, very obedient, and I don't know how she got them to do that, but there's something about that trick. But quietly as she birthed the baby. And then she went back to the bed, and things were great. It was a really, really lovely birth, about 6:30 in the morning.
Wow. So that's one element of delivering at home that is also different from in the hospitals, because the patient is moving around and she can go I guess wherever she feels comfortable.
Right.
So you're just kind of following her.
Yeah, so in the home, she can really have the baby wherever we follow her, and I always have my birth kit with my instruments nearby. And if we think baby is coming, the birth assistant will be there with always have an ambu bag nearby, just in case we need it. But the birth kit, ambu bag, we follow mama around, and we are ready for birth wherever she chooses to have her baby. And so there's no requirement that she has to be in any position. She just needs to be able to do what her body is telling her to do.
Okay. Okay. Whatever works.
Whatever works.
So, and one thing that always kind of makes me nervous about home births is just seeing some of the things that I see in the hospital. And I always wonder, like, this patient were to have her baby at home, what would the outcome have been? And so I typically kind of think, I don't really advise this, but one thing I always think is, well, for your first baby, maybe you should have your baby, in the hospital. That way, if there are any issues, we'll know about it. So, for example, if you have any heavy bleeding after your delivery, or if you develop a fever, or whatever the case may be, or if maybe the baby is really big and you're not able to push the baby out, or the baby gets stuck, I just feel like, okay, you're in the hospital. We have practically any and everything that you would need in a complication or a complicated delivery. And so I figure if you can have an uncomplicated birth in the hospital, then maybe consider for your second delivery a home birth. But honestly, you can have three uncomplicated deliveries, and then your fourth one can
The
be.
bottom drops out.
So
Yes.
it really, right. So it really doesn't matter. And so I wanted to ask you, who are some patients who you would say are probably not good candidates for a home birth?
For home birth. So with the first baby, for most primipares women, there is a high transfer rate with that first baby. And so labor can be long. She could get exhausted. There could be issues with the first baby. So there's a high transfer rate for primipares women. So candidates for a home birth has we go down the list to make sure that the mother or the birthing person is that the provider, this is the right provider, and this is the right location to birth the baby. And so that starts at the first prenatal visit as we look at blood work. And certified nurse midwives, we will do the same panel of labs that the obstetricians will do. And I tell my clients all the time, there's not much difference that's going to happen when you come see me versus going to an OB for the first visit. We pretty much do the same thing. We do a physical exam. We will do blood work to see your blood type, any problems that we can identify. I ask, do you have any type of hemophilias? Do you have sickle cell, thalassemia? Any problems that have been identified, any other problems, high blood pressure, are you a diabetic, or, or what issues that you have that might make me say that you are not a good candidate. I don't recommend that you birth the baby with me as the primary provider. And maybe you can find a practice that will have midwives, and you could have an obstetrician as well. So so midwives, we attend low risk births. And so then if there's a problem that a medical problem that needs to be addressed by an obstetrician, we have those conversations about transferring care. Or having a visit with an obstetrician to make sure that that you are well enough, and that they give a recommendation that you're well enough to birth at home. So we look at it to make sure and do a whole lot of screening. So not everybody gets to walk through the door and say, I want to have my baby at home, and where do I sign up? It's like, well, hold up, let's go down the list. And that goes all the way out until the time that the baby that the client is in labor. And once labor starts, if it's not a good idea to birth at home, we transfer.
Okay.
So it's a constant monitoring of safety.
Okay. And would you take a patient who is pregnant with twins?
It depends on the kind of twins that we're talking about. So, so if the babies are in the same sac, and so both babies are in the same sac, and there's a risk that babies could be entangled in the umbilical cords, those babies do not need to be born vaginally. So, so automatically, you need to see an obstetrician. I do have a client pregnant with twins now. They're boy-girl twins, and they can birth at home.
Okay. Yeah, I do think twin deliveries can be uncomplicated. But, at the time of delivery is sometimes when things can start to be more complicated. But like you said, as long as they're not in the same sac and things like that, it probably can be done well at home.
Yeah, so safety. And so safety and that when clients choose a midwife, it's not a guarantee that that baby is going to be born at home. It's a guarantee of safety for mama and baby. And so so hiring a midwife, hiring a certified nurse midwife, is that you want somebody there to make sure that mama is safe and baby is safe. And that's the overall goal.
That is the goal. I guess it's good for someone who strongly wants to have a home birth to just go ahead and do that initial visit with you all, kind of go through that checklist, see if they're a good candidate, and then if not, you all will kind of recommend where they should go.
Yeah, and it would be great if we had a list of obstetricians that were home birth friendly that we could call and say, hey, I have a client for you. I'd like to send somebody your way. And so that would be really nice to have.
Yeah, I was fortunate enough to even since residency work with a lot of midwives, and so that's just been the way it is. So I'm very comfortable with midwives, and I admire you all a lot. I worked with one particular midwife in residency, and so we had a pretty close relationship, and she actually had one of her children at home, which also made me a little nervous back then, but now I understand that, she definitely had the right people in the room and everything obviously went very well. So
there's some obstetricians in the area that birth at home with midwives. So
really?
Yes, really. So there are some that choose to have their babies at home too. So
oh wow. Now that's news to me.
Yeah, and there's some that choose to have their babies at home. And it's even better for them because they can kind of look at their own pregnancy too and look at the risks and the risk factors of what's happening, and they will know, like, there are no problems here. I'm just gonna bear down and have my baby, and maybe they don't want pain medication. The birth centers will have nitrous that they can have as a choice for small pain relief. It just really takes the edge off. So they will have nitrous if you want that. So that's something different. I don't know which hospitals here offer nitrous, if any are doing it. But I know in Green Bay, Wisconsin, the hospitals there, they do offer nitrous.
Okay. Yeah, so I wanted to just kind of speak on, for those women who are not able to have a home birth and that was something they were looking forward to or hoping for. Sometimes you can get, or you can request to have fewer interventions done while you're at the hospital. So I've had patients who they don't want the IV fluid. So one thing in the hospital, we want you to have an IV. You're going to get a lot of pushback if you decline an IV because we want IV access in case you need medications quickly. So what some patients have requested is just to have the IV in place and maybe not have the IV fluids. And that for them is important. And that's usually no problem depending on, their particular situation. Some patients, their baby is doing well. Maybe the mom has a blood pressure issue or something very mild. And they request intermittent monitoring, which just means that they're the monitor is not on their belly the entire time that they're in labor. And that allows them to get up out of the bed, walk around, and do some of those things. Other things that people have done in the hospital, they've been able to sit or bounce on birthing balls, not have an epidural. So that is definitely an option. Something that people do quite frequently is to birth unmedicated. And they do it well. So there are certain things that you can request. It's not necessarily a home birth, but if you are looking for something maybe a little bit more natural, talk to the doctor about it. Talk to the labor and delivery team as soon as you arrive in labor, and see what things, or see what ways they're able to accommodate you if you decide that you want to go that route.
So I think that's a very important thing to bring up, is that allowing for choice and shared decision making. I think that birthing people feel more comfortable if they knew that it wasn't going to be pushed on them.
Right.
So, and that's a team effort. So you have to talk to the nurses and the whole team about that, and the climate for when you get there, so that they don't walk in with all of this stuff saying, "Oh, I'm here to start your IV," instead of saying you have an option. You know, or I'd like to draw blood. We need to get some blood work done. If we need to have this ready, and so okay, drawing blood is different than starting the IV and having it in place. And definitely in the home birth settings, I get pushed back a little bit on that too, depending on the client, and what the hematocrit hemoglobin look like. I might recommend that we have an IV in place during labor, just in case you bleed a little bit more, and then when I need to do fluids, definitely we're doing active management in the third stage of labor, and so they don't, if there's a reason there that I deem necessary, you might not get a choice of saying I don't want Pitocin, know. So we'll talk about that when the baby's out, you will get Pitocin, And so this is for your safety and to make sure you're well. This is baby number 8, and I think you might need some Pitocin, and we're just going to do that right off the bat. We're not going to talk about it. This is what's going to happen, and having those conversations and explaining the rationale of why you're thinking that way and why we're doing it helps people to understand. But if you just come in and saying, we're going to do this and we're going to do that, and they're like, well, wait, do I get a choice? Do I get to say what happens to my body? And so we all have to think about that, and giving people the option to say yes and no about what I want to see happen to my body. But I like the whole idea of giving them choices that you can move around. You can get the same thing that you would have gotten at home, and we can, just do intermittent monitoring and all of that. That works.
Right. Yeah. And it's important, because really the whole situation is really just about them and the baby. It's their body, and so it feels good to be able to accommodate people in some ways when you feel like it's safe. To be able to have those discussions about, why we're doing what we're doing and why we think it's important for you, because, maybe your sister didn't have to have some of these things, but, your situation may be different.
Right.
One thing people have to realize, you hear stories and you read stories about certain delivery options and things that people have gone through, but their situation could be completely different from yours. So, my last question is just kind of about that postpartum care and how that is managed with the home birth. Now, I understand that, we talked earlier about you coming, the patient has a visit on postpartum day 1 and day 2. What happens for those patients who, for whatever reason, during their labor, they're transferred to the hospital, they deliver at the hospital? How do you follow up with those patients after delivery?
So they will still get those visits. So when they are transferred to the hospital, they're still in communication with me. And any questions about what's happening in the hospital, they don't understand something, they're free to call me. We can talk about what's happening and what the team is telling them. We talk about it and they get a good understanding, like, oh, okay, now we understand what's going on. While they're recovering, if they have any questions, they're able to reach out and talk to me. If it's identified there's breastfeeding problems, there's we have IBCLCs that will come to the home to see clients.
Mm-hmm.
And then there's of course therapists, if something traumatic happened, and I might recommend at about maybe 4 weeks or 6 weeks postpartum that they see a therapist, somebody to talk to and kind of process what they went through. But they will still get that day 1 and day 2 visit when they come home.
Oh,
And
good.
then they'll get a 2-week visit, a 4-week visit, and a 6-week visit.
Oh, wow. Okay.
So they get a lot of follow-up, especially first time moms, and if there was a traumatic transfer, like something happened and it was just they didn't have any say in what happened, and they just had to have the baby in an emergent situation, then I want to see them face to face in office to see, what's going on, and if I can determine or if I can identify any type of depression. But I like to see them face to face so that I can see what's going on with mom and baby, how she's interacting with the baby. And I'll always ask them to bring the baby so I can see how she's interacting with the baby.
Oh, good.
Yeah.
Yeah, I think that's what I kind of like about, the services you provide. It's just you're in constant communication with it. And even after delivery, even when you don't deliver the patient, you're still in contact. And I think that's really good for that bond, the relationship between the two of you all, and the trust back there. And then I would assume that they would really know that you care about them.
Yeah, they stick with me, and then they'll tell me, well, it didn't work this time, and so next time we'll try it again.
Right. So they're already planning on coming back.
We'll do this again. Yeah.
That's awesome.
Yeah, we'll do it again. So it's birth is one of those things that we make plans and we don't know what's going to happen on the other end, but we try to make sure that we've looked at everything and identified potential problems, the ones that we can identify and do something about, but you don't know what's going to happen in the moment. So then I'm there to make sure that they're safe, and if there's a problem identified and we need to do something, then we're just going to do it.
Right. I like that. Well, this is a great conversation. It definitely helps me feel more comfortable with home births and just really understanding that it's a lot of the same interventions that we provide in the hospital are available at home.
Yes. Yeah.
If the patient desires that environment to deliver, then that's fine, as long as they have, I hate to say a competent individual helping them, but a certified nurse midwife who has the education, the experience, and who's not taking unnecessary risks. I think that's where we as physicians kind of get nervous, because it seems like some of the risks that people take are unnecessary. But if you have the right person with you,
right,
then it should be fine.
Yeah. So we make sure that I'm coming with meds, and I'm not pushy with them, but I'd rather have than not have it. And if we have to use it, we are ready to move and deal with emergencies in the moment. Yeah, in the moment. So you don't know what's going to happen, but we try.
Right. You just always have to be prepared.
Yes.
So, Ms. Cassandra, tell us where to find you. How can people in the community contact you or find your practice?
So I'm on Instagram at MyWayBirth, and you can find me on my website, www.mywaybirth.com. My office is located in Laurel. So, and we're open Monday through Friday. You can call, but clinic days are Tuesday, Wednesday, and Thursday.
Okay. Yeah. Thank you so much for joining me. This has been so insightful.
Thank you for having me.
Hopefully we will see each other again soon.
Yes. I will keep you posted on what's going on, and then we'll go from there.
Awesome. Thank you.
All right, no problem.